The Minister for Education will be making a related ministerial statement. I will allow members to raise points of clarifications on both statements after this statement. Minister Wong.
Mr. Speaker, sir, our key priorities for the year are to implement the vaccination program smoothly and to continue with our reopening plans safely while keeping the infection under control. Minister Gan has just given an update on our vaccination plans. Let me now elaborate on our other areas of focus and what we should be prepared for over the coming months. We've worked hard together over the past year to get to where we are today. It has not been an easy journey. We have been tested severely. We've had to put in place some very tough measures. I thank everyone for cooperating with them and taking them in your stride. In a crisis like this, we've learned to expect the unpredictable. You can have the best laid plans, but new issues will inevitably crop up and some things will go wrong. What matters most at the end of the day is our ability to rally and work together to adapt along the way and to regain our footing after setbacks. That's how we were able to bring things under control, keep community transmission low, and move to phase 3 on 28th of December last year. It is a careful acknowledgement of our state of readiness to resume more activities in a controlled manner. The specific adjustments from phase 2 to phase 3 may not seem like a lot. Indeed, in his PQ, Mr. Leong Man Wai said there is little change. But let's not trivialize these hard-won gains. They are the result of the efforts and sacrifices by many people over the course of the year. Importantly, we are not out of the woods yet. We cannot afford to relax and let our guard down, as Minister Gan highlighted just now. The global situation continues to escalate rapidly. Cases continue to climb in many countries, including in places which had previously established good control over the virus. In Singapore, in recent days, we've already seen 2 family clusters. Marine workers went on board ships, they got infected, they spread the virus to their family members, including their spouses and children. One of the children had a schoolmate who visited the home and was infected. Fortunately, this happened during the school holidays, so they had limited contact with other students. But it's a sobering reminder of how easily new infection clusters can break out. It only takes one super spreader event to spark another major outbreak, so we must continue to stay alert and vigilant. The emergence of new viral strains that may be more infectious, such as the B117 variant, is indeed very worrying, and I share the concerns raised by Mr. Murali Pillay and Mr. Melvin Yong. Where necessary and practical, we will tighten our border restrictions to limit importation risk. Indeed, for the UK and South Africa, we have introduced additional testing and requirements, as well as restricted the number of travelers. We have also recently tightened the testing regime and safe management measures for those working in the aviation and maritime sectors, as they are the ones who are most likely to be interfacing with travelers and crew from overseas. For example, for air crew who have layovers in higher risk countries, we are testing them more frequently after they return to Singapore and require them to self-isolate for a few days. Likewise, we are doing a one-time testing sweep for all marine workers, and we are increasing the frequency of testing for these workers who go on board vessels. We are testing them every 7 days instead of 14 days. This is not the first time we've picked up new strains of the virus, nor will it be the last. The fact is that the virus has always been mutating and will continue to do so. Other new strains will continue to emerge. We do not know what their cumulative effects will be like. So we will have to constantly monitor the latest developments around the world, review the data and evidence, and update our measures accordingly. With the virus raging around the world, we clearly cannot afford to freely open our borders at this time. But neither can we close ourselves completely from the world and simply stop all flights or ships coming to Singapore. Trade and travel are our lifeblood. This is an existential issue for us because we do not have the luxury of a hinterland to depend on. Therefore, we take a calculated, risk-based approach in managing our borders. Minister Ong Ye Kung recently made a ministerial statement on this, so I will just reiterate some of the key points. To facilitate essential business and official travel, we have established special travel arrangements with certain countries and territories. We control the number of travelers on these schemes tightly, and we require the travelers to stick to a controlled itinerary, and we strictly limit interactions with the wider community. For example, we have a fast lane between Singapore and 6 provinces and municipalities in China, established in June last year. Ms. Cheng Li Hui asked how many have taken this up. So around 500 travelers have arrived from China under this arrangement. Of course, since early November, we've also allowed short-term Chinese visitors to enter Singapore via the air travel pass. In order to promote both Singapore's economic interest and our status as a global business and transportation hub, we will continue to negotiate and formulate additional travel arrangements with other like-minded countries or regions while ensuring that public health is not compromised. Recently, we also announced a new travel lane called Connect at Singapore. It's aimed at a limited number of business officials and high economic value travelers coming to Singapore for short-term stays. As it would not be practical for these travelers to serve a 14-day quarantine, we manage the risk by placing a bubble wrap around these travelers. So the travelers will only stay at dedicated facilities and they will not be allowed into the community. They will also undergo regular testing and observe all prevailing safe management measures. Besides these special travel arrangements, we have on a daily basis a far larger number of travelers who are returning Singaporeans, permanent residents, and long-term pass holders. There is also a continued flow of new migrant workers coming in, mostly construction workers and foreign domestic helpers. We need them to build our homes and infrastructure and to support the caregiving needs of our families. For these returning residents and essential workers, we allow their inflow on a controlled basis, but we require those who are from higher risk countries to serve a 14-day SHN, stay-home notice, at dedicated facilities. They will be tested at the end of the SHN. Travelers from countries with new virus variants will serve their SHN at designated hotels to further minimize the risk of spread. This system ensures that we are able to tightly ring-fence imported cases and minimize the risk of leakage into the community. Since 18th of November, we have required all non-citizen and non-PR travelers from higher risk countries or regions coming to Singapore to take a pre-departure test within 72 hours prior to their departure. We have not required this of citizens and PRs because we do not want to place additional barriers for them to return home if they have urgent need to do so. Additionally, as pediatric testing services may not be so easily available in some countries, those aged 6 and below are also exempted from this pre-departure test. But through the stay-home notice, we ensure that community transmission risks for these travelers are minimized, even in the absence of a pre-departure test. So in response to Mr. Gerald Giam's query, between 18 November and 27 December last year, there have been over 12,000 travelers, including citizens and PRs from higher risk countries and regions, who entered Singapore without pre-departure tests. So far, around 100 or 0.85% have tested positive. Importantly, none of these cases has resulted in local transmission. We recognize that our containment measures depend on good management of the hotels which are used as SHN facilities. We make sure these facilities have strict protocols in place to segregate persons on SHN from other guests. These include placing them in segregated blocks, wings, or floors, clearly demarcating their routes of movement, and instituting regular cleaning and disinfection regimes. Persons on SHN are not allowed to use common facilities in the hotels. Once there's a confirmed case, comprehensive contact tracing and ring fencing of contacts, including staff working in SHN facilities, will be done to prevent further transmission. and any links between confirmed cases from the same facility will be thoroughly investigated. Even with these multiple layers of safeguards, the risk of leaks, though small, remains. And the recent incident at Mandarin Orchard Hotel is a case in point, as Mr. Ang Wei Neng highlighted. Based on our preliminary investigations, there have been no breaches in the SHN protocols at Mandarin Orchard Hotel. But investigations do suggest that infection protocols can be improved, for example, through better crowd regulation, as well as having good ventilation systems to circulate more fresh air. So we will continue to work closely with all SHN hotels to ensure that infection prevention protocols are robust. As an additional safeguard, all hotel staff in contact with SHN individuals will henceforth be placed on a 14-day rostered routine testing regime, or RRT. Monitoring the genetic information of the virus in Singapore's COVID-19 cases has been important in uncovering the Mandarin Orchard Hotel incident and is required to detect any importation of new COVID strains into Singapore. Specific to Dr. Tan Wu Meng's question regarding whole genome sequencing in Singapore, this is an established capability within the National Public Health Laboratory. Where possible, whole genome sequencing can be performed rapidly and directly on clinical samples of COVID-19 positive cases. However, in samples that have low viral loads, it may be necessary for the virus to be cultured before the sequencing can be done. We will continue to assess available and emerging laboratory technologies so that we can improve our capabilities and enhance our responses. One important issue is whether we can relax our border measures for persons who are vaccinated. We are studying this issue very carefully. As mentioned earlier, the main benefit of the vaccine is that it offers protection to the vaccinated individual. It is likely that vaccination can also reduce the risk of transmission of the virus. But at present, we still do not know the extent of the reduction. There are several ongoing studies on the effectiveness of vaccines in reducing transmission risk, and we are monitoring these very carefully. So to Ms. Herting-Ru's question, if there is clear evidence that transmission risk can be lowered significantly, then we will certainly consider some relaxation to the SHN regime for vaccinated travelers. But for now, we will continue to take a more cautious approach. In other words, vaccinated travelers will continue to be subjected to prevailing border measures and SHN requirements. We will fine-tune our approach over time once we better understand the effect of the vaccine. Of course, border measures are just one part of our overall system of defense against the virus. Within our community, we must continue to adopt a calibrated approach towards resumption of activities in Phase 3 and minimize the risk of any further flare-ups during this period. The tools for us to do this are not new. We have repeatedly emphasized them throughout the past year, but I think they bear repeating as we begin this new year, because memories are short, as we all know. First, we must uphold safe management measures. Under Phase 3, we can go out in larger groups of 8 people. By all means, use the opportunity to catch up with family members and loved ones, but please do so responsibly and in accordance with prevailing rules and restrictions. Unfortunately, there are a few who persist in pushing their luck and disregarding the rules. We have stepped up checks over the festive period, firm enforcement actions have been taken, and we will continue to do so against any such breaches. Let's also not forget some of the basic measures that we have put in place, all the good practices that we have emphasized and cultivated over the past few months remain very important. Wearing a mask, practicing good hygiene, washing your hands regularly, and not using your hands to touch your face. Remember, we talked about all this repeatedly at the start of the outbreak last year. Let's not forget them. They are simple, but still very effective. Second, testing remains important, and we are continuing to deploy more tests as widely as possible so that cases can be detected quickly. Anyone who sees a doctor with acute respiratory infections or flu-like symptoms will be advised to take a PCR test. On average, we tested more than 14,000 individuals every week in the month of December last year through this surveillance mechanism. That was how we picked up several of our recent cases. So it is very important for anyone who feels unwell to see the doctor immediately, and if the doctor advises you to be tested, please comply with the doctor's instructions. For those engaged in higher risk activities, we are putting them on a rostered routine testing regime, or the RRT. This already applies to workers in the construction, marine and process sectors, as well as to airport and marine workers, and now to staff in the SHN hotels, as I mentioned just now. Beyond the RRT, we undertake special testing operations from time to time to do a sweep around specific areas or groups of individuals whom we assess to be at higher risk of transmission. Over the past few months, we have done such tests amongst staff of nursing homes, hawkers, as well as bus and taxi drivers. This month, we'll be testing the students staying in our university hostels. We have also been stepping up the use of rapid antigen tests. They are useful as a pre-event measure for larger scale activities. They are also a very good complement to the PCR tests, which are more sensitive but take longer to obtain results. The costs of these rapid tests have been coming down. The first of such rapid tests administered in Singapore cost about $80 per person. That's not just the test itself, but also the operations and manpower cost. Now, it's possible to do this for under $50 per person, and the cost is likely to come down further. Over time, we can expect more innovative rapid test kits that are cheaper, faster, and more convenient to administer. These will enable us to test more extensively and conveniently to detect positive cases and protect our population more comprehensively. When we first deployed testing in a significant way, I know that there were concerns among certain groups. Some thought it would be a hassle. Others worried that there would be a stigma associated with being identified for testing. But I hope by now we can all appreciate and understand the reasons why testing is important and necessary. Frequent and widespread testing is a critical enabler which we intend to ramp up over the coming months. We must all start getting used to the idea of regular testing being a part of our lives during this pandemic period. Third, we will continue to strengthen our contact tracing capabilities. Despite our best efforts at safe management measures and testing, we know that cases will still slip through from time to time. That's why we need to be able to quickly identify and trace the contacts and ring-fence the clusters. The Trace Together and Safe Entry program has been and will continue to be a key part of our contact tracing operations. Before Trace Together, we had a good contact tracing system, but it was manpower intensive. It worked well for SARS, but not for COVID-19, where the virus spreads much faster, well before the onset of symptoms, and even in cases who themselves remain asymptomatic. In the past, it took 2 days for us to interview an infected person, establish all of his close contacts, and then get in touch with these people and put them on quarantine. 2 days, that was too slow. Today, with TT and Safe Entry, we are able to do all this in a matter of hours. Once we identify the contacts, we test them immediately at the start of their quarantine. And for those who are positive, we in turn get their TT data to identify their contacts and then initiate the tracing process. In this way, we try to get ahead of the virus and contain clusters before they get any bigger. Our ability to do all of this is not just because of the TT program. It's fundamentally because of the confidence and trust that Singaporeans have in our system, the way we handle the data, the way we go about doing contact tracing. And I thank everyone for their cooperation and support, because this has enabled our contact tracers to do their work and to keep cases under control. To date, we have spent around $10 million on developing both the Trace Together app and Safe Entry system. Mr. Gerald Giam asked if the cost is justified. Well, the results speak for themselves. Trace Together has stopped the transmission of the virus in many instances and has helped save many lives. So I have no doubt about the cost effectiveness of the program. Of course, in developing the program, we remain mindful of the need to ensure value for money. So, for example, Mr. Dennis Tan had filed a question on whether we could work on a rechargeable version of the Trace Together tokens. Doing so would inevitably increase the cost and also the time needed for manufacturing. Instead, we have designed the tokens using off-the-shelf components where possible to minimize manufacturing complexity, time, and cost. More than 4.2 million people, or around 78% of Singapore residents, now participate in the Trace Together program, and we certainly encourage even higher take-up. Not all of them use the token. Quite a number, around 2 million, or slightly less than half, just use the Trace Together app on their phones. I'm one of them, because I think that if I have the token with me, I'm quite likely to lose it. Right? So I just use my phone, and that works well for me. But we recognize that some people want the tokens, and that's why we made them available and we distributed them across all the community centers. Given that the TT app was easily available, we had initially not expected such a strong demand for the tokens. And on the supply side, there were also some delays in the manufacturing schedule. And that's why, as mentioned by Mr. Lim Biao Chuan, we were not able to complete the distribution of the tokens across all the CCs. We have been steadily building up the inventory of the Trace Together tokens and will soon be able to resume distribution in the CCs that are currently closed. As announced previously, we will also be distributing the tokens to school students who have not yet collected them through the schools. After everyone who needs a token has had a chance to collect one, we will put in place a requirement to use Trace Together only at the safe entry checkpoints. In other words, we have what we call TT-only safe entry, where the safe entry checking in, checking out is done either through the app or the token. We will give further information on this once the details and timelines are firmed up, and will provide adequate advance notice to all the affected establishments so that they can gear up and prepare. Mr. Speaker, 2020 was undoubtedly a difficult year, but we can take heart that we have learned and grown tremendously in our abilities to cope with the virus. I thank everyone who has worked so hard and made many sacrifices to get us to where we are today. Our healthcare workers and frontline officers, contact tracers, safe distancing ambassadors, our swabbers, enforcement officers, immigration and security officers, airport workers, our SHN operators, they have all been working hard round the clock. There are also many who have contributed, many unsung heroes all over Singapore doing their part. Toward the end of last year, Minister Gan and I held a simple appreciation event in accordance with all safe distancing rules, of course, to thank the people involved in setting up the COVID-19 community care facility. This is at the Expo and Big Box. Members will recall this was a pivotal moment in our fight against the virus. At the peak of the pandemic, we had more than 1,000 cases per day, and our healthcare system was at risk of being overwhelmed. The team came together from both the public and private sectors, and in the spirit of SG United, they got the facility up and running in a matter of days. They truly made the impossible possible. Now we have stood down the facilities at Expo and Big Box because we do not need them for now. I told the team we will do our best to avoid calling on them again. I think they were quite relieved to hear that, but I was also very heartened when they said, "Don't worry, if the need arises, we will be ready to respond anytime." That's the indomitable spirit that gives me confidence in our fight against COVID-19. We must not allow this prolonged vigilance to wear us down. We must not falter, we must not weaken or tire. Let us approach the new year with the same spirit of fortitude, solidarity, and unity that we have shown over the past year. Let's finish the job and complete our mission together. Thank you, Mr. Speaker.